Hey, what's going on, everybody? Welcome back to my channel. Alright guys, so for today's video, like I mentioned in the previous video number 1, this is video number 2, I'm gonna talk about the main points to study for the DAANCE certification. So like you guys know by now, there is 5 modules in the textbook, and I'm just gonna go quickly through each module and I'm gonna give you the main points to start. Just remember that the best way to do this, guys, is to basically study the whole book. But from my point of view, from my experience, I will let you know, I will tell you what I saw on the exam and what I think is the best things to know and to learn as well, guys. Okay guys, so let's go ahead and start with module number 1. Alright, so for module number 1, I believe that it's very important to know the 12 cranial nerves. Now, I believe personally that the main nerve that you have to know is nerve number 5, which is the trigeminal nerve. Just remember that this nerve has actually 3 divisions, okay? So the way that I learned this trigeminal nerve was by using basically 3 fingers, okay? So this nerve has 3 divisions, like I said. The first one, which is the very top one, okay, which is like this, hold on. this is the way, guys. So just remember, cranial nerve number 5 has 3, 1, 2, 3. The very top one, guys, that is the ophthalmic nerve. The second, which is the middle one, remember that is the maxillary nerve. And the very bottom one, the last one, that is the mandibular nerve. Alright guys, to continue with module 1, after the 12 cranial nerves, I believe that the second most important thing to know is the autonomic nervous system. And for this, there are 2 subdivisions. The sympathetic nervous system and the parasympathetic nervous system. Alright guys, the next thing you should know is the cardiovascular system. Now just remember that you have to know the anatomy part and the physiology part of the heart. So what do I mean by anatomy and physiology of the cardiovascular system? Anatomy pretty much meaning the parts of the heart. So make sure that you memorize the whole heart and the name of each part. When I'm talking about physiology, I mean how the heart works. And the main 2 things that you should learn is how the blood runs through the heart. From when the blood enters the heart, blood goes to the lungs, lungs takes the blood back to the heart, and then the heart pretty much pumps the blood to the body. Another thing that you guys have to know is the systolic and diastolic pressure. The main point here, guys, is, and I know there's going to be 1 or 2 questions about this in the exam, is the systolic and diastolic. Meaning when you take the blood pressure on the patients. When exactly systolic happens and diastolic happens. Another thing that you guys have to know about the heart is, remember, there's 3 things. The stroke volume, the cardiac output, and the cardiac cycle. And to go back to the electrical system, which is the heart conduction system, just remember, of course, I mean, we know that everything starts from the heart's pacemaker, which is the signal. Make sure that you learn all the conduction system, guys. It's very important. And basically that is part of the physiology of the heart. Another thing that comes with module 1, guys, the systolic and diastolic, and when it happens, is you have to learn how to take the pulse. There's 2 main points in the body. We got the common carotid artery. Number 2, the radial artery. Now, another very important thing is the respiratory system. You have to make sure that you learn how the oxygen that we breathe in goes from our oral cavity down to the lungs. Now with this, guys, you have to make sure that you learn the anatomy part of the upper airway and the lower airway as well. Now when it comes to the respiratory system, guys, there's two things that you have to memorize as well. Number one, the dead space. Number two, the tidal volume. Alright, and to start with module number 2, these are the main points you have to learn. Even though you are not the one who checks the patient before surgery, on the day of consultation, there is 3 main things you have to learn as well. Number 1, that is the review of systems. And remember that there's 8 of them. Learn about the 4 parameters. And number 3, you have to learn all Mallampati classifications as well. Make sure you know about the MI, myocardial infarction, and how everything happens. Now, this is the most important one for module 2, guys. And these are the arrhythmias of the heart, or also known as dysrhythmias. Cardiac dysrhythmias, or cardiac arrhythmias, which is the same thing pretty much. Now, this dysrhythmias or arrhythmias you're gonna find in the textbook exactly on page 34 and 35, guys. You have to make sure that you know each name of each dysrhythmia, but also make sure that you learn all the little graphs. With this, guys, make sure that you also learn all the waves, which is the P wave, QRS, and the T wave. I know for sure, guys, that when you guys take the exam, there's going to be about 3 or 4 questions about the graphs. So make sure that you learn those as well, because this can be a little difficult and confusing as well. Alright, guys, so I'm done with module number 2. Now it's time for module number 3. Before I start, guys, I want to let you know that the most important modules here, I mean, they're all important, and please make sure that you read the whole book. But the 2 most important ones for me, guys, for my experience, was module number 3 and module number 5. So here, guys, you guys are gonna learn about the different drugs that we use in that OMS office, or oral and maxillofacial surgery office for outpatients. Now, guys, make sure that you learn about the 3 different things that the drugs causes to our patients. Number 1, analgesia. Number 2, amnesia. And number 3, hypnosis. Alright, guys, so before I finish module number 3, I want to tell you that, of course, I'm not going to go through every single drug that we use in the office, but what I want to do is I'm actually going to do a separate video about the drugs that we use to sedate our patients. Now, there's going to be different drugs, guys, that we use in our office to sedate our patients, and you guys have to make sure that you learn them. Now, another thing, guys, that you have to learn is number 1, and I'm sorry if I'm not pronouncing this the right way, but number 1 is pharmacokinetics, and number 2, pharmacodynamics. You have to make sure that you learn both and the difference between them. The other thing that I think is the most important as well is you have to learn the difference between sedation levels, and there's 4 of them. The first one is minimal sedation, and these ones are the anxiolytics. Number 2, moderate sedation, and this is basically still conscious sedation, meaning the patient's awake and he is listening, he knows what's going on, but he is very relaxed. Number 3 is deep sedation, and this is the analgesia. And number 4, we have general anesthesia. Another thing, guys, that you have to learn is between esters and amides. And I'm talking about the local anesthetic that we use in our offices. Alright guys, so that's it for module number 3. Now we're gonna start with module number 4. Alright guys, so in this module you have to make sure that you learn the different machines for anesthesia. Basically the ones that supply the oxygen and the nitrous oxide. The same as the vaporizer, so meaning the vaporizer are used for inhalation sedation, and the ventilation of the office, meaning the scavenging system. So please remember the scavenging system. Another thing, guys, that you have to learn is the color code system for the cylinders. For example, the one for the oxygen, which is green, nitrous oxide, blue, nitrogen, black, yellow is for compressed air. Alright guys, to continue with module number 4, this is the most important, I believe, for module number 4. And these are the different equipments that we usually use for any emergency situations. For example, to intubate our patients. Of course, this is something that you never want to go through, but you have to make sure that you know this, you have the knowledge of how everything works and where everything is. For example, the nasal and oral pharyngeal airway, the LMA, the ETT, the combi tube, and another thing, guys, is for any emergencies, basically your last resort, the cricothyrotomy instrument. You have to make sure that you learn the equipment that you use to monitor your patient. For example, capnography, the EKG, the pretracheal stethoscope, which is sometimes used, it depends on the office. This is mostly used, I know, in hospital settings, and the blood pressure cuff. And remember, this is very important because, of course, this is the way that you're gonna monitor the patient before and during the surgical procedure. Alright guys, and to finish this video, the last module, which is module number 5. Alright, pretty much I'm not gonna go through this module, guys, because I believe, like I said, this is the most important one. You have to make sure that you read it and you understand it, and of course learn it. For this module, guys, you have to learn everything. In this module, guys, they're gonna talk to you about all the emergencies possible that can happen during the surgical procedure. For example, obstruction, laryngospasm, bronchospasm, hyperventilation. Some patients, they're too nervous and they hyperventilate. Another one like syncope, which is fainting, scissoring, and malignant hypothermia. Alright guys, so before I end this video, I want to please ask you to like this video. Please make sure you subscribe to my channel. Any questions, concerns, please make sure you leave them down there in the comment area. And guys, don't forget that I'm going to be making a third video about the drugs that we use to sedate our patients in the office.